Hey y'all, my name is Rachel Howell and I'm a student physical therapist assistant at Jefferson State, and today I'm going to be talking to y'all about cellulitis. So what exactly is cellulitis? Well, it is a bacteria skin infection, and it usually affects the surface of the skin but can also affect the underlying tissues. Bacterial skin infections and soft tissue infections occur when the bacteria invades broken or normal skin and start to spread under the skin into the soft tissues. Infections result in inflammation, which can cause pain, redness, warmth, and swelling. And that's just the body's reaction to the infection. The most common types of cellulitis, there's two, is strep and staph. And it can be as just like that, if I can get a good angle. There we go. Red, just kind of splotchy like, or it can be in the eyes. Like so. I mean, that's pretty rough looking. Now you might ask what age or groups are affected. People at an increased risk for developing cellulitis include those with trauma to the skin or other medical problems such as diabetes, circulatory issues, liver disease, iron overload, skin disorders such as eczema or psoriasis, or infectious diseases that cause skin lesions such as chickenpox, athlete's foot, or severe acne. And it's shown to affect the elderly more, but it really can affect anybody. Now, how does somebody get diagnosed? Well, it's actually really simple. They can just take a blood sample, and that will show the blood culture will show that they have cellulitis, or you can take cultures of the pus or drainage, if there is drainage or pus from the infection. Like that eye picture I showed you, she had some pus around the lid or some drainage, but that first picture of just the red splotchiness, it was just kind of a minor infection. It wasn't very severe, so there wasn't a lot of drainage. So they would just take a blood sample and diagnose that person. What is the treatment for cellulitis? It's really simple. The doctor usually will prescribe oral antibiotics that you take between a week and 10 days. Now, you want to make sure that you finish all of the antibiotics. You don't want to leave a couple left to save for later, because you really want to make sure that that infection is gone. The doctor may also use IV or intramuscular antibiotic injections in situations where the person has a really weakened immune system, if the infection is severe, if they have other medical problems going on, if they're very, very young or very, very old. If the cellulitis involves extensive areas, like the areas close to important structures like the eye, like I showed you, they might do IV. And if the infection is not improving or worsening after 2 to 3 days of taking the oral antibiotics, then they'll probably be put on IV. What is the prognosis of people with cellulitis? Well, most people respond to the antibiotics in 2 to 3 days and begin to show signs of improvement. In rare cases, the cellulitis may progress to a serious illness by spreading through the bloodstream. Some forms of severe cellulitis may require surgery and leave a person with scarring. And rarely, cellulitis can be life-threatening. So the more internal the cellulitis gets, the more severe. So if it's just on the top of the skin, that can usually be treated with just antibiotics. Like that first picture I showed was just a little red splotchiness. But the more internal, if it gets into the bloodstream or on your internal organs, that's when it can become really severe. Now, what are some physical impairments or functional limitations? If the infection reaches the bloodstream, cellulitis can significantly affect a person's ability to work. Kind of like what I was saying earlier, the more internal the cellulitis gets, the more severe it gets. Associated functional loss is possible as a result of the scarring and pain limiting range of motion. So that should tell you right there that if they come to therapy, range of motion is pain control, and range of motion is something that we'd probably be working on with them. An example of a way it can be limiting if a person gets this, if like the orbital cellulitis can progress and make somebody blind. It can also have cavernous sinus clots or inflammation of all tissues of the eye. So if a person gets it in the eye, that's really serious. You don't want them to get blind. They need to be immediately taken to the doctor and get that looked at. And another example, if it's in the eye, the infection may spread from the orbit to the brain or tissues lining the brain and the spinal cord. I mean, if it gets to the brain and the spinal cord, it could kill somebody. Deficits addressed in physical therapy. Well, with cellulitis, we follow practice pattern 7B. And according to the guide to PT practice, interventions we can use are patient education and integumentary repair and protection techniques. So we're going to be doing a lot of wound care with these patients. Some precautions: hand washing. Hand washing is the best way to protect yourself, not just with cellulitis, but with anything. You don't know what these patients are carrying on them. If they got from a family member, from another patient, you just always want to make sure that you protect yourself. And also wearing personal protective equipment when you're touching the patient. These infections are transferable. Most of the time they're going to be on contact guard precautions, so you want to make sure that you have, gowns. If it's internal, you might be on the face mask and gloves. Make sure that you just protect yourself and other patients. And how cellulitis will affect a person in therapy. Well, if they're already in therapy for something else, getting cellulitis can put them behind, because now the PT or PTA has to take extra precautions to make sure that infection is not transferred to other patients or themselves. And getting cellulitis is not a reason to stop therapy. It's really all up to the doctor's orders. If it's internal and it's affecting some major organs, the doctor might, prescribe you all to stop. But if it's a minor infection of cellulitis, most likely you're just going to have to take extra precautions. Well, that is all that I have for cellulitis. I hope y'all enjoyed this and maybe learned a little something. Thanks.